Hi, Chris. I'm doing well. Thank you.
Thank you so much for making yourself available in the middle of what I'm sure is a crazy schedule at NH hospitals. This is a 30-minute segment of just kind of hearing your points of view from the front line of healthcare. So how about we just start off with a quick introduction about yourself, and then we can get this going.
My name is Viren Shetty. I'm the Chief Operating Officer of Narayana Health, which is a hospital group based in India. We run 24 hospitals across the country, operating across the entire spectrum of the human body. We are best known for cardiac sciences, but we also have a huge oncology, neurology, neurosurgery, gastro program. We are doing a lot of interesting things in digital health, and our company is focused on making healthcare more affordable, accessible, and more easy for patients to get all the healthcare needs taken care of.
Thank you. I think it is truly amazing what your chain and your brand has been able to establish in democratizing healthcare in many which ways. Yeah, we're talking at an opportune time. There seems to be a slight bit of a lull in the middle of the second wave that hit us all. So I'm just going to start off by asking my first question, which is, what, according to you, was the biggest shift that you have seen in your business and perhaps the healthcare industry in general, pre-COVID versus post-COVID?
Yeah, I think what we're seeing with COVID is one of those epoch-defining moments, right? You can very clearly draw a line between what the world looked like before and after. So if you look at a traumatic event like 9/11, and there was a world that existed before that, and there's a world that existed after, and the world that exists after is very different. So the COVID pandemic is a bit like that. There is a world and a set of assumptions we had about it that was true before COVID, and I don't think any of those assumptions will hold true anymore. The biggest change in our perception, at least in my perception for me, between the pre-pandemic and while the pandemic was going on and now, is that I kept holding on to hope that we would enter a world like it was before, that we wouldn't have to worry about pandemics anymore, that once the first wave had subsided, that was it. We can go back to normal, things will go right back to the way it was. But as the second wave turned out, it proved not to be the case, and it looks like there may be multiple waves of this in the future. So it means for a business like ours, really thinking hard about what this new, very volatile, very unstable world looks like, and imagine this as a permanent state, right? Where you're always uncertain, where you never know if the flight you've booked is going to get canceled. You have to worry about your medical appointments, your vaccine status. You have to be a lot more concerned about going into public areas and just generally a lot more aware about your health. So if this is what the world looks like, I would say that currently the way hospitals like ours are configured, we are absolutely not equipped to deal with that, because our businesses are built around doing elective surgeries on people who know what they want and are able to plan it well in advance and choose to come, assuming they will be taken care of. But this COVID brings a lot of uncertainty into the mix, and so there are a lot of things we have to do to change how we run our hospitals.
That's very interesting, and specifically around the impact of COVID, phase one versus phase two, from a medical perspective and also from a customer care perspective. How has that been different?
I would say from a medical perspective, in phase one, we came in with a lot less knowledge about how to actually treat the disease. We, for example, didn't even know that face masks were an important precautionary measure in the first one, and we didn't know which drugs to take care of people. In phase two, medically, we knew more or less what should be done. We still obviously had a lot to learn. I think what doctors knew what had to be done is that there really isn't nothing much you can do other than just take care of the patient's symptoms and hope that they recover by themselves. But what was worse for clinicians in phase two was that just the sheer volume of patients that overwhelmed the system. And so it meant that there just wasn't enough medicine to go around, weren't enough ICU beds to go around. There weren't enough doctors to take care of all the patients that needed it. And so it was more, we were feeling a lot more helpless in phase two of the pandemic. I would say from a business perspective, the differences between phase one and phase one was obviously, while the disease itself was a lot shorter and contained, The business was impacted because it was preceded by a very long nationwide lockdown before. And what a lockdown does, it prevents people from leaving their homes and coming in to get the normal set of surgeries and OPD appointments that you normally would do. And so financially, we were hit a lot more in phase 1 and phase 2. Phase 2 was very short, very concentrated. What happened was that all our elective cases just went away and they all got replaced by COVID. Now, it still had quite a huge financial impact for us because COVID is just something we decided not to charge people a lot for. Our hospitals were full and we were just about breaking even on most of them. So I would say that phase 2 didn't hit us too much financially, but definitely was still a very traumatic event for a lot of the people who had to take care of patients.
And to your point earlier, in terms of the hospitals and the current structure of how hospitals are run, being impacted in itself, and also as a corollary to that, the impact on the patient or the consumer. How is that different? Could you elaborate on that a little bit?
How is that different between
pre-COVID versus post-COVID?
See, it was so much easier for us to be customer facing and doing things built entirely around the patient pre-COVID. So we have, large waiting areas. We have an ability to deploy a large number of staff to go to patient and see how you're doing. The problem with COVID is that it's sort of like, playing one really bad game where you're in a room and you're trying to figure out who the bad guy is. But the trick is everyone could potentially be the bad guy. And so you never know who is a carrier, who is not a carrier. It breaks down this connect that you have with patients, and you make our staff suspicious of every single one. And then you have to create all these barriers between yourself and the patient, physical barriers, and you have to create space barriers, and you can't let people into the hospital. They need to be kept outdoors, and doctors don't want to spend more time with the patient than they do. And everyone gets angry when the mask is down. So it just that level of patient connect is very hard to recapture in the physical hospital setting now, because we have to put in so many COVID safe protocols. And it works both ways. It's not just that the hospital is frustrated with the patient. The patients are extremely frustrated with the whole healthcare experience. The experience of going to a hospital, getting temperature checked, getting the RT-PCR, waiting, worrying about, who in the waiting room with me has COVID, doing the normal things on top of the anxiety that this regular checkup could lead to me getting COVID is an extremely frustrating experience for a lot of patients. And so a lot of this has to change, but this is something that we just have to work towards and make time. But yes, definitely it's not going to be the same patient experience one can expect. And if it turns out that we have to start doing 80% of the things that used to be done in a hospital, out of the hospital, at their home, online, in their workplace, on an app or on the phone, that's how it has to be. It may not be as good as it was before. It may not be the same experience, but it doesn't matter because it keeps everyone safe. And that's what's most important.
And so you believe that this is here to stay. Fundamentally, there's a tectonic shift in the way hospitals are being run and patients are being cared for.
See, now I could be wrong. The thing about predicting the future is that when you're wrong, you always tend to look quite foolish about it. But let's say that it is. So even without COVID, even without the threat that you can catch something by going into a crowded area, just think about the experience of visiting a hospital. You have to get your car or your bike. You have to drive in a huge amount of traffic. You have to negotiate for parking in someone's parking space. You need to get yourself registered in some counter. You need to wait. You visit a doctor, then again, more waiting, more counters, more registration. And so something that could be done 5 minutes, 15, 20 minutes online has turned into a half-day chore for you. So yeah, so even from a comfort and ease of access perspective, maybe digitizing a lot of things or putting it in less clinically intensive settings could be a more patient-friendly scenario, regardless of whether there's a raging pandemic going on or not. So even if there isn't a pandemic, it's not that we don't have other diseases you can catch in a hospital. There's, multi-drug resistant bacteria that's been there for many, many years. There's a common cold, which has been there for thousands of years. There's a flu. There's any number of things you can catch, not just in hospital, in any crowded place. And I guess as people are becoming more, germophobic, it would seem that if this pervades, then yes, then we have to think about it. But of course, It could also be that we just forget everything, go back to living life as it was. I think as people, we're just very good at forgetting trauma, and that's a good thing as well. Then maybe things go back to normal and I don't have to worry so much. But just in case, things change, we're making steps towards ensuring that we remain relevant in a permanent COVID future.
It's a very interesting point. I often think about a scenario because in a country like India, where the number of bed penetration per 1,000 people, etc., is so low, and where providing access to healthcare deep down inside our country is such a difficult thing. We seem to be the perfect candidate for things like telemedicine or digital health and using all the possible technology avenues. But at the same time, we also have tremendous inertia, because the idea of going and talking to the doctor sahib, and kind of experiencing that just seems to be a lot more comforting. That dichotomy seems, something one is always trying to deal with, right? What are your opinions about that?
I would say just a little correction to that. I wouldn't personally go and conflate digitization and telehealth as an alternative to the fact that, as a substitute for the fact that we don't have enough healthcare in this country. I think those are two very different things. Digital medicine, as it stands right now, is a convenience for the top 10% of the country that has smartphones and data plans. I think for the other 90% who live in villages, who may have a smartphone, but they don't know how to use it, who don't know how to navigate, for them, technology is the hindrance. So, see, it is a great enabler, no doubt. And millions of people have been benefited from cell phones and using WhatsApp to communicate and all that. But it's a phased process. Right now, the systems are built by who? They're built by people like us, who are completely internet savvy, digital natives. And it's meant for other people like us who understand the internet the way we do. But people who've never been on it, who don't know the difference between the internet and Facebook and WhatsApp, for them, this is not a very intuitive way. So I would say that the problems of people that don't have healthcare can only be solved by getting more healthcare to them. And that still remains relevant to build more clinics, build more hospitals, train more doctors, and treat them. But what I would say to the second part of your question, which is it does provide a much more convenient solution, because you are able to access a lot more in a shorter period of time, make it more convenient, and possibly by aggregating a lot of data, possibly pick up things that you wouldn't otherwise before. If you visit 3 different doctors in a pre-internet world, each one writes something on a piece of paper, and you only sort of, the database of that is the file that you may lose or you may not lose, and there's no guarantee that the third doctor will scan the reports of the other 2. But when everything's digitized, then of course it's a lot easier for the software itself to pick up those things. But that is something could pick up very interesting things for patients. So healthcare will improve with digitization, that no doubt. It'll make it more convenient for patients. It will do all those things, but it's going to take a lot of time. It's going to take a lot of effort. It's going to take a lot of buy-in. It's going to take a lot of money, and will still remain for the next 10 years a preserve of the upper class. And then as we figure it out and we make it simpler, it starts to percolate down below.
So that's a perfect segue into my next question. From your vantage point, if you had to list 3 fundamental changes that we need to implement over the next decade, what would those be as a country and as the healthcare industry?
So as a country, the 3 changes you have to implement, number 1, I would say you have to make health insurance mandatory. To run around, see, you can't even drive a bike or a car without auto insurance.
Yeah.
Right? It doesn't matter if you can get the most garbage policy available, but you need auto insurance, because given the chance, you may crash, you may never crash. It doesn't matter, but in case you do, you need to be covered. Health insurance is a bit like that. You can't walk around on the streets. You should not be allowed to walk on the street without health insurance, because you never know. And with the pandemic, so health insurance, I believe, has to be made mandatory. Now, as more people start getting into it, they have to start working with insurance companies to figure out ways to lower the cost, to provide very low premium plans that can cover a basic set of diseases, rather than right now, everything is basically a platinum coated plan with certain, very basic exclusions. Now, it's good because everyone gets the same level of care, but it makes it expensive. right? There are people that are younger who may not need everything covered because it's very unlikely they're going to get a heart attack at the age of 20. But you need millions and millions of 20-year-olds buying insurance to subsidize the cost for the 50 and 60-year-olds buying health insurance. If you don't do that, the only people buying health insurance will be the sick people, and the people who are sick will drive up the cost there. So I would say number one policy, you have to make health insurance mandatory. Number two, that would necessarily have to be done is just liberalize the whole medical education and medical nursing, paramedical, anything with regards to that. You have to liberalize it, open it up to private, foreign institutions, any number of people to train as many doctors and nurses as they want. You're talking about a huge jobs crisis in this country, and that we are a services oriented country. We're not a manufacturing country. We can't build as well as China, Vietnam, or Thailand that are so much ahead of us. But we've always been a country built around services. That's what we're best at. And so we have to embrace that and recognize our role that services is the future. Manufacturing is 20th century, services are the 21st century. Indian doctors, nurses, paramedics are recognized the world over.
Absolutely.
So liberalized medical education will solve not just our problems, but we'll be able to take care of the healthcare needs of the whole world with an army of doctors and nurses. So liberalized medical education, so anyone can start a college, no restraints, no restrictions, no entry barriers, and you get to lower the cost of education there. That will have a downstream effect because the more doctors there are, the better healthcare will be in rural areas and the lower the cost of healthcare will come. Third thing I would say as a country, and I only have two, if I have to say third thing that can improve medicine in India, maybe just a standard set of regulation around digital health and unify that with, don't create the separate thing on digital health and think it's separate from regular health. I would say that it all just needs to come on a standard, common standards. So there is just one set of medical records and one way of treating medical record, whether it's paper or on a database, it shouldn't matter. Similarly, there should be only one way to consult with the patient. If it's on the phone or the video or in person, it should be treated the same way. So by creating this unified system of regulating healthcare, whether online or offline, that would, at least simplify a lot of things and make it clear how to do. From the healthcare industry perspective, the three changes, at least I can't speak for the rest of them, but the things we are focusing on, number one, bringing healthcare out of the hospital. We say we're in the healthcare business as NH or all the other hospital groups. We're not. We're in the selling surgeries business, right? Our entire hospital group is built around making surgeries affordable. Now, obviously, surgeries are what people need, and we're able to treat them with the highest levels of safety at the lowest cost. But whether the surgery was actually required or not, there's not enough effort put towards that. So as we get into the healthcare business, we have to be fully integrated. So that means having a large number of clinics, having a large system of treating patients out of the hospital, not necessarily in the hospital, so that when patients come, their total healthcare is taken care of by providers. It's called many names. In abroad, they call it integrated care, they call it accountable care, they call it health management organization. There are many names for it, but essentially it means that as a person, I don't come to a hospital when I'm sick. I come to an institution and say, you're taking care of my health, right? My weight, my mental well-being. If I get a heart attack, once I get old, all of that, you're here to take care of that. And so as we become fully integrated that way, we are able to do better for our patients because we can prevent all the things they could have done prior to needing the surgery. And so the surgery stops being necessary. So that's number one, of course. Number two, we'd have to change is invest in technology, a lot of technology. We have a huge team of engineers. We're hiring a lot more engineers. This is not a problem we can sit around and wait for Apple, Google, or Microsoft to solve for us. They've just built the little building blocks. It's up to us to take it, put it together, and turn it into something that's useful for our doctors and for our administrators and hospitals. Hospitals have to invest in tech, otherwise you're just going to be left behind and not provide a great experience for your doctors or your patients. The third thing I would change is try and find an integrated payment model. The one thing that we always struggle with is that this fight between patients that are paying and the hospital that need the money, or insurance companies that pay and hospital that need, but there's no reason why the two would not be aligned. The best models for healthcare that exist in the US are fully integrated health systems that combine payers and providers. So Kaiser Permanente is the best example of that, where since you're paying them to be healthy, they take care of your total health. And so you're not worried so much about how much the surgery cost. It shouldn't matter. The fact is you're just paying him to keep you healthy. Whether a surgery is involved or not is an irrelevant question. So those are the three things we would work on.
I think those are all fantastic points. And your first bucket where you talked about insurance, and the second bucket where you talked about a unified payment system, I think that's something that we're seeing as well in a country where we have 65% of the population that pays out of pocket and continues to pay out of pocket, and the 35% that do have insurance are usually underinsured. It means that that individual is almost always fending for themselves on figuring out how to pay. And then, of course, there is the Chinese wall between what is controlled by the IRDA and the insurance industry, and then everything else that falls outside. When we look at, why far away, but even countries like Singapore, you have a unified system where a company can come in and provide that complete care in many ways. Do you see, and I know that insurance or healthcare insurance is definitely increasing in India, but do you see a scenario over the next 10 years where that is in any which way going to overcome or overtake the out-of-pocket medical expenditure piece in our country?
It has to. So one is the inevitability of it. 20 years ago, it was 90% out of pocket. Now it is 65%. Hopefully, it's 40% or 30% by the time I retire from this business, or maybe it's gone. Now, how you do it, whether you have a forcing mechanism by everyone has to buy insurance, or a lot of innovative payment models spring up, or these integrated healthcare providers come up, that's up to players like you and me to figure that part out. So I would say it will happen because it's inevitable, but the way it has to happen will be interesting. I think the most interesting challenge of our time is trying to figure out how the law adapts to this, how people take it up, whether people trust, paying the hospital to take care of their total health, or whether you trust, these aggregators, intermediaries to take care of that, and how people see themselves as various parts of the equation. Because there's always going to be a push and pull.
Absolutely.
There's someone that is paying for it, wants to pay as less as possible, and someone that needs to do the procedure needs to be paid as much as possible. And so the way that aligns is going to be an interesting challenge.
Absolutely. And the one that is paying always wants it to be the lowest. We see this in our business where we deal with corporates all the time. The corporates believe that offering employee health benefits means just getting group health insurance, and the national average per person cover is just 3 lakh rupees. And because they believe, and that has remained pretty much constant. And if you're in a very good company, then maybe it's 5 lakh rupees. And we know that in the event of something happening, 5 lakh rupees is really not going to pay for anything, which means invariably that individual pays from one side. But let's switch gears. Let's talk about that, the average Indian, right? According to you, or in your experience, what are the biggest fears for an Indian when looking for healthcare? I'll give you a few options and maybe you can pick from them. Choice of finding the best doctor, choice of finding the best hospital, the right advice about what their options are as far as healthcare is concerned, the lack of insurance or inadequate insurance, hence their inability to pay for healthcare, or lack of medical infrastructure, beds, medical equipment, diagnostics, etc.
Okay. And here's where you're going to have to define for me what the average Indian is. Because if you go by the national statistics, the average Indian earns about $2 a day. So is that your definition of average Indian, or is average Indian, like a employed blue collar worker?
That's a good point. Let's for the sake of this discussion, assume the employed Indian.
Okay. If you're employed, then it would be, I would say the finance part comes, it's always front and center. You worry a lot, and we've seen this time and time again. Like every patient that comes, they get their medical doubts answered, but we know they're not paying attention, because the thing at the back of their mind that's ringing like a bell always is how much is going to cost, how much is it going to cost, how much is it going to cost. So you can't, separate out the cost aspect. So the number one concern almost all of them are going to have is how much it's going to cost, whether they can afford it, whether the insurance covers it, whether the company covers it, whether have to sell any assets to pay for this. I mean, we're just, at least for our group, we're always so sensitive to the fact that most of our customers can't really pay for the true cost of what we're offering them. And so we find ways to discount it, subsidize it, give them generic options, but cost is always at the back of the average person's mind. The second part would be the second biggest concern. Not so much about the hospital infrastructure. I don't think people really care that much about that, barring maybe the the well-heeled set. Most of them just want to know whether this is the procedure, the treatment, the medical diagnosis that you're going for is the simplest. Doesn't require anything risky, invasive, getting your chest cut open, staying in the hospital for 14 days. So they will shop around if necessary for the one who tells them, look, medicines can treat you, you'll be fine. I would say the second most thing on the mind is the kind of treatment that they're offering, and not opting for the one that has a less risk to life or getting operated on. So that's the second most important concern I found that the average person has. The third would be, yes, it would be everything else that you mentioned. It's hard for me to bracket all of it. It would be the infrastructure, it would be the doctor, whether he spoke nicely to me, whether he comes from my hometown, whether I was confident in the things that he said, and just that all of that would be inconsequential compared to number one, cost, number two, do I really need this procedure?
Brilliant, brilliant. We talk a lot in our country about medical tourism, inbound tourism from other countries, neighboring countries coming into India. But we don't really talk that much about interstate tourism, right? And we're seeing migratory crowds coming to the nearest big city or the nearest possible hospital to find that care. What is your opinion on that? Do you see a lot of that in your group as well?
Yeah, see, I don't know where I read this survey, but it showed on the reasons why Indians travel within India. Number one, work, obviously. Number two, going back to my native place for, any holiday or puja, pilgrimage, whatever. Number three, healthcare. Number three is the number three reason why people travel within India is to get healthcare. Whether it is going from a village to the district headquarters to get a treatment done, or going from a tier 2 city to tier 1 city, or going from a big city to an even bigger city, or going abroad. Yeah, that is a quite underappreciated reason why people travel. Why they travel? So there are well-established patterns. So people from East India tend to always travel to South India for healthcare. How can we explain it? We can't. That's just the way it is.
That's very interesting.
People from all over North India just go to Delhi for treatment. How do you explain it? I don't know. Delhi seems to be the focus of North India. People from Punjab travel to Bikaner for cancer treatment, even though they're very good hospitals in Punjab as well. In fact, there's a train that's called the Bikaner, the Cancer Express, because it just carries a huge number of cancer patients to this very well-run government hospital in Bikaner. And it's just been like that. People just travel. We have no idea why. So yes, it's an underappreciated part. I guess it's a sense of comfort. If everyone around you, so let's say you're in Bangladesh or Agartala or somewhere in the eastern parts of our country, and everyone and has gotten treatment, and they say, "Kahan gaya?" And they say, "I went to the south." They're very good people. Where? No, just south. And so they end up in Chennai, they end up in Bangalore, they end up in Hyderabad, they end up, in all these cities, and they just know you go to a hospital, you'll be treated well. It's a stereotype, if you want to call it that.
True.
Similarly, it doesn't matter wherever you're in North India, Dehradun, Mewar, you just anything. Hey, go to Delhi. The only time you don't go to Delhi is during COVID, and that was the time no one went to Delhi. But other than that, you're in Delhi for treatment. Anything, shopping, Delhi, school, Delhi,
right,
treatment,
it's the
Delhi.
center of gravity for North India, right?
Yeah. So yeah, and I think essentially hospitals respond to that, and so you have situations in Bangalore, Chennai, Hyderabad, Delhi, where it's quite overbuilt. There are more hospitals. If you go by the WHO standard for what is the average number of hospitals per 1,000 people, 2.7, whatever it is, all these cities are well in excess of three per 1,000. And that's because you're not just dealing with the local crowd, you're dealing with everyone else that comes in.
True, true, true. You mentioned about investing in technology, so telemedicine, remote healthcare monitoring devices, virtual care management. I mean, there are quite a bit of inventions happening, right? So a couple of points related to that. Number one, how disruptive or real do you believe they really are or can be? How relevant are they in the Indian context? I think you touched upon that a little bit earlier. And if you were to just kind of blue sky this over let's say the next 20 years, not 10, but like 20 years, what would that picture look like? Could you paint us a picture?
Yeah, I think we're still fairly early on. So, I mean, people of our age and the social media, right? You look at the impact social media is having now. It's destabilizing governments. It is, changing the nature of discourse online. It's possibly ruining the human experience. But regardless of whatever it's become now, and you think, oh, this all started with Facebook in 2006. Not really. I mean, social media existed from, if you go back to Orkut, you go even back to ICQ, you go even back to Usenet, you go even back to those, the command line chat. I have no knowledge of that, but I know those things existed way before my time. So it just took 30, 40 years, and it kept growing, and then it became ubiquitous, and then that's how it is. So the technology in healthcare will be like that. Telemedicine is not new. Telemedicine has existed since the time a telephone was there. So you felt sick, you called your doctor on the phone and said, something's going wrong. He said, yeah, take this tablet, you'll be fine. That was telemedicine.
Right.
Your grandparents did telemedicine. What it is today, it's the super convenience that you have. You can be in a small town, you can access any doctor you want. And so it's good, but still not there yet. As more and more features get added, as IoT sensors become more embedded everywhere, as we start unifying databases of people's health all over, it just starts to, these incremental things keep building one on top of the other until the net result is this extremely powerful solution. I don't know what that will look like. I don't know if, as some futurists believe that the internet can take care of your health. Like that will just automatically decide what's wrong with you. You won't need doctors, maybe. But at least what it will do, it will make the clinician's life a lot easier, because everything is simple. It's all formatted. It's available in one place. You have a common set of record. If you don't feel like driving to a clinic, you can do your clinic from the house. Same for the patients. You don't need to leave house for treatment. So healthcare will become more convenient. It will become more accessible. And in time, the costs, the barriers, all of that will start coming down as we solve for ease of use of these apps, network connectivity, the ubiquity of healthcare practitioners available, and it will start getting more democratized. So 20 years out, it will look very different. It will just be, I would say, more of the same trends. It will keep getting safer. It will keep getting more convenient. It will keep getting cheaper. And the way you think you need to access healthcare will not be the same. So just like you don't need to go to a DVD store to watch movies, I think you won't need to go to a hospital to get healthcare or a clinic to get healthcare. That's what it would look like.
Absolutely. Just look at how communication and meetings like these, and things like Zoom have become so ubiquitous now, right? My final question, as a hospital and a healthcare brand, what is the hurdle that you focus on overcoming the most? Is it reaching and helping more people, expanding your reach, as it were, reducing cost to make healthcare more accessible, or any other?
It's reducing cost. I mean, from day one, the only reason this hospital was created is because the founders worked in health systems that they felt didn't do enough to reduce the cost. That's it. Like everything we do, the size of the hospital, the use of the technology, going into multiple cities was done with the primary goal that can we reduce cost for people. And that is just the overriding goal. Now, of course, we're reaching the limits of how much all our cost-cutting efforts are doing. So now we're trying to look at if we can reduce the total lifestyle cost. So rather than reducing cost on a per procedure basis, because we really can't do any more, it will be let's reduce the cost by eliminating your need to have that procedure. And so rather than spending 1 lakh, 2 lakh for the procedure, you pay me 10,000 for 20 years. So that's half,
That's a great way to look at it.
Yeah. And so in the end, that will mean I can prevent that procedure from ever being necessary.
So you're in a way trying to kind of bring the whole hedging and the insurance part of the business into the care management bit in some which way. Yeah?
No, that's the only way our interests are fully aligned, right?
True.
Otherwise, if you're in the business selling surgeries and someone comes, I feel sick, guess what you're going to say? You need a surgery.
Yeah.
Whereas if our interests are aligned around your health and I'm take care of your health, great.
Absolutely.
Then I guess you don't need that surgery. Just lose weight or change your diet or take these medicines, and we can possibly look to prevent that.
Absolutely. I did say final question, but really the final question. Do you believe that the third wave is going to happen?
Again, I think it's inevitable. I read somewhere that Japan is on its fourth wave, Korea is on their third wave, China has multiple mini waves. It's tough to say. I personally thought that we were just done with one wave. The first time around, I sort of had at the back of my mind that a second wave would happen, but it would be somewhere far in the future. But the speed and the ferocity of which it just came everywhere was astounding. I think all bets point to there being a third wave. Simply, okay, so if you run the logic behind it, still a huge number of people will not be vaccinated by the end of this year. And COVID has impacted everyone, and I would say majority of the country has been around someone with a COVID or a COVID patient. But this damn virus mutates, so it can affect you not just once, twice, 3 times also. And so what happens is there will inevitably, because there's so many hosts for this thing, there will come a time where it's mutated and figure out, okay, I can be even more sneaky. But I'm holding out hope for somewhere I read that the Spanish flu came in 3 waves. First wave was, pretty bad. It killed millions of people. The second wave was even worse, killed even more millions of people, but nobody knew about it because World War I was going on. And third wave was there. World War I was kind of winding down, so people knew more about it, but it didn't kill as many people. The ultimate accommodation strategy, the ultimate strategy for any virus or pathogen is to find an accommodation with the host. Because if it kills the host, it dies, and that's not a successful evolutionary tactic. If it manages to survive, enough so that it's like the cold. The flu, the Spanish flu evolved into the seasonal flu, and some previous pandemic would evolve into common cold. So I'm hoping 3 years from now, all of us will be back in the office doing things as we normally did, and you'll see your coworker and he'll be wearing a mask, and you'll say, boss, what's going on? What's with the mask? And the coworker says, oh no, I have COVID. And you'll say, oh, okay. And then you go back to work. That's it. I mean, that's what's going to happen.
That's a fantastic, and I guess from a somber note to a more positive note to kind of just end this on. Thank you so much, Viren. It's always a pleasure to speak to you, and I think the insight has been brilliant. Thank you for making yourself available for this call.
Thanks, Chris.